One of things more recurrent with the notion of reality and fiction is psychosis. In fact, lots of people suffer of this trouble, and they lose contact with reality. This disease must be called trouble of personality. Most people can be schizophrenics. Schizophrenia is a good example of trouble with fiction and reality. Schizophrenics can have hallucinations and delusions. However, they are deeply convinced that their imaginations are real. In 1911, Eugène Bleuler was the first doctor to call this trouble by this name. Thus, we discovered that many famous people were schizophrenics, like philosopher Jean-Jacques Rousseau, painter Vincent van Gogh, singer of Pink Floyd Syd Barrett, or John Forbes Nash Jr., a great mathematician. There are many kinds of this trouble and many classifications. At first, simple schizophrenia, where people have problems with their relations between them and other people, and they isolate themselves. At second, paranoid schizophrenia, the most frequent form of this trouble. Delusions and hallucinations are present. At third, catatonia. Patients with catatonia may experience an extreme loss of motor skills or even constant hyperactive motor activity. Catatonic patients will sometimes hold rigid poses for hours and will ignore any external stimuli. Patients with catatonic excitement can suffer from exhaustion if not treated. Patients may also show stereotyped, repetitive movements, so they can repeat same sentences, for example. And at last, dysthymia. It's a mood disorder consisting of chronic depression, with less severe symptoms than major depressive disorder. During the 20th century, doctors practiced lobotomies to cure mental patients. However, they became as socials. Nowadays, it's difficult to cure schizophrenia, but there are methods to help schizophrenics, like antipsychotic medications or psychosocial interventions may be useful in the treatment of schizophrenia, including family therapy, assertive community treatment, supported employment, cognitive remediation, skills training, cognitive behavioral therapy. But this trouble exists since a long time and can touch everybody. It's a good example of problem between reality and fiction, where the mental patients can see borders.